Good morning, everyone. My name is Andrea Esteves, and it's a privilege to be the Dean of the Faculty of Dentistry here at UBC. And I'm delighted to be your Masters of Ceremony for this event. We have exciting news to share today, and I have to say, it is remarkable that such important announcement is made here, where oral health care professionals are educated while caring for the public. I would like to begin by acknowledging that the land on which we gather is the unceded territory of the coastal Salish peoples, including the territory of the Musqueam, Squamish, and Tsleil-Waututh nations. And what a wonderful land it is. I want to take this opportunity to thank each and every one of you for taking the time to be here with us to celebrate the launch of yet another milestone for the Canadian Dental Care Plan. Let's go right to it. We have the pleasure to be joined today by two cabinet members. The Honorable Terry Beech, Minister of Citizen Service, thank you for being here, and the Honorable Harjit Sajjan, President of the King's Privy Council for Canada, Minister of Emergency Preparedness, and Minister responsible for the Pacific Economic Development Agency of Canada. Thank you for being here. We live in a time when the oral health of Canadians is being recognized with as much importance as general health, finally. We all know oral health plays a vital role in physical, mental, social, and even financial well-being. Without further ado, I invite our host, the Honorable Terry Beech, Minister of Citizen Service, to talk about today's new significant milestone for the plan.
Thank you, Dean Esteves. Bonjour à tous, c'est un grand plaisir d'être ici avec vous ce matin. I also want to echo the Dean's acknowledgement that today's ceremony is taking place on the traditional territory of the Musqueam, the Squamish, and the Tsleil-Waututh people. And I also want to acknowledge the many oral health professionals that are attending today. And I want to say thank you, because I actually had the great privilege and opportunity to spend some time with Dean Esteves before the announcement today. And she just knows so much. I ended up asking her so many questions. I got to learn a lot of different things. But one of the biggest things that I learned was this facility during the pandemic was one of, actually the only facility that continued to provide in-person services during the pandemic. And so people that had toothaches and had dental emergencies were able to come here and get served. And so my big thanks to everybody that were working those clinics and making sure that Canadians were getting good oral health care at one of the most difficult times in our country's history. And so to be here today with this announcement, and as the Dean just articulated, bringing dental health up to the same standard that we treat healthcare, I think that's quite significant. We launched the Canada Dental Program in December. We know that this is the largest rollout of any benefit program in the history of our country. We expect 9 million Canadians to benefit. If you spread that across a full year like peanut butter, that's 25,000 people that need to enroll a day. And we've had pretty significant success. To date, there are 2.1 million Canadians who have successfully enrolled. That has been primarily seniors. We've now opened up the process for those individuals aged 65 years older. But today, we are taking it to the next stage. As of today, children under the age of 18 can now apply for the Canada Dental Care Plan. And those individuals with disabilities, specifically those that have a disability tax credit certificate, can also apply today. Now, how in demand are these services? Well, I try to be a prudent minister, and despite the fact that we are making this announcement today, and this is the official launch, we actually soft launched at 3 o'clock in the morning yesterday. And I am happy to say that in the first 24 hours, over 3,000 children and 2,000 individuals with a disability tax credit certificate have already applied and become eligible for the program. That's quite significant, and I think it shows the underlying demand. We know that there are approximately 983,000 children that will qualify for this. We know that there are further 183,000 individuals with a disability tax credit certificate that will qualify for this. That means that there are an additional 1.2 million individuals that, as of today, will qualify for the Canada Dental Care Program. Now, if you're seeing this and you're wondering, how do I make sure that my kids get dental care, you can go to canada.ca/dental. Now, this is a very easy process to apply for. I'm happy to say that the user testing that Service Canada has been undertaking with some diligence has been paying off. More than 85% of individuals that go online to fill out the form are able to become eligible without any assistance whatsoever. But it is a digital-first strategy, not a digital-only strategy, which means those individuals that might need some extra help in applying can feel free to go to a Service Canada website and apply in person, or you can call over the phone at 1-833-537-4342 in order to apply for dental care. We also have a number of accessibility options, including access to an audio CD, Braille, the digital accessibility system, or getting the applications in large print format. We will do everything to make sure that no matter what your circumstance is, that as of today, you can get dental care. I will also say that this is the next step, but not the last step. And starting in 2025, all those individuals between the ages of 18 to 64 will be able to apply starting in the new year, and hopefully we can get closer to that 9 million person number. To date, there are over 200,000 individuals that have actually seen a dentist, and the stories that we have seen across the country are people's lives literally being changed by access to this service. But it's not just a good news story from an oral health perspective, it's also a good economic story. We know that investing in people's oral health care makes them more productive, gives them better long-term health outcomes, and saves our healthcare system further down the road. So it is one of those happy situations where it is the right thing to do morally, but it is also the right thing to do economically. And I thank all of the oral health professionals that are here today that are helping make this program a success. With more details, it is my great pleasure to introduce my colleague and friend, Harjit Sajjan. Harj.
Thank you, Terry. It's great to be here at the UBC campus making this announcement. And before I begin, I too want to acknowledge that we are gathered on the traditional and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. I want to also thank you for UBC for hosting us here today, and also acknowledge my good friend and colleague, Wilson Miao. It's great to be home also for the summer, and to be here today to deliver some exciting news about the next phase of the federal Canadian Dental Care Plan. Now, since we launched this program, as Terry's already mentioned, over 2 million Canadian seniors have successfully applied for the program, and approximately 200,000 of these seniors have already received oral health care under this plan. Now, this is life-changing for so many Canadians, and is a generational change in our dental care. And now we are announcing that adults with a valid disability tax credit certificate are also eligible to apply. Now, this means that close to 1.2 million more Canadians will soon have access to more affordable oral health checkups and dental treatment. We know that persons with disabilities often experience a greater burden of oral disease, and they have more complex and higher oral health needs, which can be expensive. And we know that children need early dental checkups regularly to help ensure that they have overall health. Now, as a matter of fact, in Canada, poor oral health causes more than 2 million missed school days annually. In Canada today, this is not acceptable, and we can and we will do better. Because we know that people living with disabilities and young families should not have to go without oral health care because they cannot afford it. Now, this is not right, and plus, it's definitely not fair. With the Canadian Dental Care Program, we are proud to make oral health care more affordable, now creating fairness for every generation. Now, this change will have a significant positive and a lasting impact on our children, our youth, our seniors, and people living with a disability across the country. This historic public plan will eventually cover up to 9 million Canadian residents with family incomes below $90,000 who do not have access to dental insurance. Now, let's think about that number alone here. That's 9 million Canadians. Now, that's a lot. Now, that is roughly the combined population of Toronto, Montreal, Winnipeg, Calgary, and also Vancouver. They are our parents, our kids, our neighbors, and our friends. And this plan will have a huge impact on their lives. The new Canadian Dental Care Plan is one of the many ways that we're helping Canadian families, because we know that times have not been easy. And the opportunities afforded to previous generations are not accessible and sometimes feel out of reach. This is why supporting middle-class families is our top priority. $10 a daycare program, the free contraceptives, access to dental care, like the announcements that we're making here today. Now, this is fairness for every generation. Now, before we take questions from the media, I want to also take a moment to contrast Bob Pierre Poilievre's message from the Conservatives. Now, you've probably heard a lot from him lately about affordability in Canada, but what you have not heard from him is his own plan. Now, his caucus voted against our plan for generational fairness. They supported tax breaks for the wealthiest, 0.1%, and over fairness for the middle class. He wants you to know that in his Canada, you are on your own. He wants to cancel your access to dental care, and he does not care about what that means for you in the long run, because they really think that it is fair for nurses to pay more taxes than millionaires. So simply put, we do not agree. We're asking the wealthiest among us to pay a little bit more so that more Canadians will be able to receive care, more seniors, more adults with disabilities, and more children and youth. And we will not waver on that commitment, because this is fairness for every generation. Thank you so much, and happy smiles to everyone.
Well, thank you very much. Thank you both for being here at UBC Dentistry. We are now ready to answer some questions from the media. I will hand it off to Eric Nosluk to moderate the question and answer. You are invited to come to the microphone and ask your question, and then one follow-up question if you wish.
Thank you very much, folks. If I can just please ask to identify what media outlet that you're in, and as the Dean mentioned, one question and one follow-up.
Jack Moore, City News. So you mentioned that 2 million people have signed up so far. The uptake's been very high, but only 200,000 people have actually gotten dental care. That's about 10% of the people who've signed up. What's the disparity there?
Mostly time, I think. We've had people signing up since December. We've only had the ability for people to actually go to the dentist. In fact, since May 1st. The first person to go to the dentist was at 7:08 a.m. in Newfoundland, if I remember correctly. So what's it, we got May, June, we're going into July. So it's only been 2 months of actually being able to deliver the services. So, signing up was relatively easy. You could fill out a form, or you could make a phone call to make that happen. Being able to book a dental appointment, then actually get yourself down to the dentist, that takes a little longer. And as I said, we've been signing up people since December, but we've only been providing dental services since May.
Okay. We're hearing that dentists are slow to get on board with this, issues with the rates. Can you tell me, what does the uptake in dentists look like? And if we are not getting dentists on, it doesn't really matter how many people sign up, does it?
Yeah, so that's a great question. I'm happy to address it. And of course, the health minister has more details on this than I have. But I do know that as of this morning, there's approximately 11,500 oral health professionals that have signed up under the current program. I think that represents about a third of dentists. There were concerns that were raised, including some of the administrative burden. We talked about some of that this morning. I would highlight that July 8th, that changes. So individuals will be able to get their dental service in the same way that they would with provincial or private health after July 8th, meaning that you can literally show up with your dental card. It'll be processed like every other single program that's out there. So dentists don't even need to sign up. So to date, we have a third of the dentists signed up, but July 8th is only less than 2 weeks away. And at that point, every single dentist will be able to have the ability to provide services.
Thank you, Minister.
Thank you.
Hi, Luis Lopez, CBC News. Mr. Sajjan, please. You said you directed the military to help a group of Afghan Sikhs during the Afghanistan evacuation in 2021. What's the difference from directing and ordering the military to do this?
Okay, let me address the Globe article quite directly, because I'll be honest with you, it was utter BS. Those who were following the evacuation missions and then events previously to that know quite well that there was an approved government policy to safely evacuate as many vulnerable Afghans as possible, which included obviously Canadians first, those who worked with us like our interpreters, and it also included vulnerable Afghans, which included religious minorities like the Afghan Sikhs and Hindus. And I can assure you, all effort was done to carry this out and do it in as safe as possible manner, and to get as many people out as possible as well. And I also want to just mention the fact, to read that story and to take some of these questions, given that it was a approved government policy that we were executing. I'll be honest with you, I didn't think I would be getting those questions if I wasn't wearing a turban. And those who actually know me quite well, that throughout my careers and my service, I've rarely ever even talked about racism and what it actually meant. But I'll be honest with you, it needs to be called out. And the reason being, just last night, my daughter was not even aware of this articles to come out, and she on her own was talking about the visceral hatred, and she's 15 years old, by the way, visceral hatred that you see online, and the kind of messaging that's being pumped out there on social media. And I had to, console her, saying, you know what, it was better before. What I meant, it's better now than it was before. It doesn't make it easier for her to see this. And I couldn't tell her at that time, by the way, there's another article that's going to be coming out that is going to kind of justify the type of questions she's even asking now. And I know that she's not alone in this.
Sorry, but what's the difference from directing and ordering the military to do this? I also have a follow-up question.
Sorry.
What is
See
the
the follow-up question?
No, what is the difference between ordering?
What I can do is,
directing
I can
and
happily have my press secretary provide you a very thorough statement on this regard.
And the follow-up question is it appropriate for a defense minister to direct the military like this? Is that political interference?
I'll give you the statement, but on this, the military is under civilian command, under Minister of National Defense, and the job of the Minister of National Defense to execute the government policies of the day.
Okay, thank you.
Mike Hager, Globe and Mail. Thanks for taking questions. Minister Sajjan, one more time. The sources in the Special Forces said that, there was no effective difference between direction and an order. What is the difference to you?
What I will do is, if you will have that statement passed on to you, I think it will make it very clear what took place.
Okay, and then did you text command or offer direction about other groups during those chaotic days of the fall of Kabul?
As I said, I could give you my press secretary and provide you with the statement, but there were many vulnerable groups, and I was getting contacted by many different groups, which included everything from the women's soccer team to vulnerable parliamentarians, LGBTQ, many others, and all that information was just being fed up so that our folks can do the best job they can to bring as many people out as safely as possible, which included Canadians and interpreters as well.
So you were feeding more information?
Everybody was
those other
feeding as
groups.
much information as well from every source that was provided, because we want to do everything in our power to get as many people out as safely as we could.
Okay, thank you.
And Minister Sajjan, Neetu Garcha with Global National News. Just in the context of whether this was an appropriate use of resources at the last minute before the Taliban took over the country in August of 2021, and there was a severe need to rescue translators, women, people who had assisted the Canadian military. Again, if I could ask point blank, in terms of your instruction or asks to other vulnerable groups and this particular group, did you instruct or ask Canadian Special Forces to rescue Sikhs who had no connection to Canada?
Neetu, I believe that you followed it very closely, and as I mentioned, is my press secretary will provide you with a statement that will provide all the necessary information. As I mentioned, this was government policy, which was approved, and that's something that we was executing. Thank you.
And just a quick follow-up, if I may, did you instruct or ask Canadian Special Forces to rescue or prioritize any other group of people who were not Canadian citizens, permanent residents, or who had not worked in Canada, who were not Sikhs?
This statement will clearly answer those questions for you.
Okay, thank you.
Thank you.
Thank you very much, and that wraps up the media Q&A part, and I will hand it back to the Dean.
Thank you so much for being here today. A day when oral health is in evidence is always a good day. This will conclude our event. Thank you for your participation and for being here at UBC Dentistry.